Hello, my name is Tamika, and I am an MSN student at Auburn University. Today, I will be performing a head-to-toe assessment on Mikael Lyman. He has agreed to allow me to perform a head-to-toe assessment. Before I go in to perform my assessment on Mikael, I washed my hands to perform hand hygiene. I also reviewed his data and seen that his vital signs, his heart rate was 86, his blood pressure was 110/60, his O2 saturations on room air were 99%, his respirations were 20, and his temp was a febrile at 97.8. I also noticed that today is just time for Mikael's annual exam. He has no known allergies and no chief complaints. So I'll begin my assessment. I asked Mikael to please empty out his bladder just for his comfort before we perform the assessment. So I'll begin with just looking at. Can you scoot over just a little bit?
This one.
I'll begin with just performing an assessment by looking through Mikael's scalp. I'm looking for lesions, ulcers, or any asymmetrical dislocations or anything. So I'm going to look through his scalp. I don't notice any lesions or any tenderness or any abnormalities in Mikael's scalp. So now I'll just look at his skin. I'm just looking at his general appearance, and I don't notice any type of skin lesions or any dryness of his skin. His skin is warm and dry to the touch. I'm looking at his eyes. I'm making sure that they're symmetrical to his ears. I'm looking at his nails, his nasal. I'm looking at his lips. I'm looking at just his general appearance. I'm going to begin my assessment. I'm going to do my check my cranial nerves 1 through 12, and so I'll begin with just simply asking Mikael to do a few things just to check his cranial nerves as I assess his vision. As a matter of fact, I assessed his visual acuity in his 20/20 on the Snell's chart. Now, I'll begin to assess Mikael's, looking at his forehead, checking his sinuses. I'm asking, do you feel any pain or pressure in your sinus cavity? Okay. Still looking at his eyes. I'm noting the color. I'm noting that there's no redness in his sclera or conjunctivas. I'm noticing that his mucous membranes are nice and pink and moist. I'm looking for any type of abnormalities in his skin, and I haven't noted any. So I'm going to ask you just to do a few things for me, okay?
Yes, sir.
Will you please just follow my hand and, okay? Ready? Just with your eyes. Thank you. Will you please open your mouth and put your tongue on both cheeks? Say ah. Okay. Okay, that's good. I'm checking Mikael's lymph nodes, checking to make sure that there is no enlarged lymph nodes. I'm just still feeling and assessing. I'm going to get my pen light, and I'm going to assess, checking for making sure that his pupils are equal, round, and reactive, and they are to light, and they are. I'm going to look in his nares while I have my pen light out. I'm just looking for ulcers or any type of deviations, or I'm looking for any type of redness, any type of abnormalities is what I'm looking for. I'm going to also go ahead and look into his oral mucosa. Look at his, observe his oral mucosa. Can you say ah again? I'm looking back at his uvula and his peritonsils, tonsils. Can you lift up? I'm looking for any type of decay in his teeth. Raise your tongue up. Okay. I'm gonna also go ahead and look into his ears with my otoscope. Just gonna look inside of there, looking at his tympanic membrane, which is clear and intact. His canals are clear. I don't see there without lesion. Okay. I'm gonna also go ahead and check his and perform my Weber and Renin test on his hearing. I'm gonna use checking for bone conduction as well as air conduction, and do the same. Okay. I'm also, can you open and close your mouth for me? Say ah. Okay, and close it down. Close it down. Okay, go one side to the other. Okay, very good. Can you stick your tongue out at me? Okay, very good. And so we continue to observe. I'm gonna ask you, I'm gonna come over to the side and I'm gonna say a number and you tell me what number am I saying. Okay, could you cover this ear? I'm gonna whisper a number in your ear and you tell me what number I said.
42.
Okay. Do on this side.
88.
Okay. So I want you to watch. Tell me, I'm gonna check your peripheral vision. So let me know when you can see my hands, when they come into view, okay?
Right there.
Okay.
Right there.
Okay.
Right there.
Okay, very good.
Right there.
Very good. So we've assessed, can you shrug your shoulders for me? Okay, let them down. Okay, what is your name?
Mikael Lyman.
What's today's date?
April 19th.
Do you know where you are right now?
Yes, ma'am.
Okay. Can you please, I'm going to give you 3 things that I want you to remember, okay?
Yes, ma'am.
Air, pop, dog, okay?
Yes, ma'am.
I'm going to complete my assessment, then I'll come back to you with those, okay?
Yes, ma'am.
So now I'm looking at his chest wall. I'm looking for asymmetrical. I don't see any. I'm going to go ahead and check. I'm checking his pulses, carotid arteries. Checking his, and we're supposed to check one at a time. Okay, I'm going to check your radial pulse. Brachial pulse. Femoral pulses. Okay. Popliteal pulses. Dorsalis pedis pulses. And pedal pulses. Okay. Can you turn your head from one side to the other for me? That way. But can you press against my head with resistance? Okay. Try not to let me turn. Okay, good job. Now, what are the 3 things that I told you?
Air, pop, dog.
Okay, very good. Okay. Now I'm gonna go ahead and listen to long sounds. Okay. Can you take a deep breath for me? Okay. Again. While I'm listening to long sounds, I'm gonna go ahead and listen to his carotid arteries, listening and assessing for any bruits. Also listening to lung sounds and heart sounds. S1 and S2 are normal. No S3 heard. Lung sounds are being assessed. Okay. Can I listen under here? Okay. Okay. Can you turn to the side for me? Okay. 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 I want you to turn back around for me. I'm going to put my hands on your chest and I want you to repeat after me. 99.
99. 99.
Okay. Can you turn around for me? Is there any way possible you can turn all the way around? Okay. Will you repeat 99?
99. 99. 99.
Okay. I'm going to just put my hand. Can you take a deep breath for me? So making sure that he has bilateral lung expansion, that my hands are flaring out at the same time, and they are. Okay. And while I'm back here, I'm just going to go ahead and check for any type of spinal deformities. And I'm going to check for CVA tenderness. Percuss. Okay, you could turn back around. Okay. If you could grab one of those, please.
Yes.
I'm gonna assess his abdominal area. Take it back down, please. Okay. Back on your back. Okay. Go ahead and look. I'm looking at his abdominal area. I'm noting if there's any abdominal distension or bloating or anything abnormal that I don't notice any. Okay. Gonna listen at all 4 quads for his abdominal sounds. I've looked, I've listened, and so now I'm going to feel listen to his aortic artery. Listen to his iliac arteries. Listen to his femoral arteries. Okay. You can sit back up. Okay. Now I'm going to check his reflexes. Just relax your arm down. Okay. Okay, good job. Can you relax your legs? Okay, good job. And good reflexes. Very good. Okay. When I was checking your air conduction and bone conduction, I forgot to ask you. Well, I would put it on top of his head as well, and I would ask him to allow me to know if he hears the same noise the same sound in both ears, or if the noise was heard better in one ear or the other ear, as well as the bone conduction. You did your eyes, you did your nose.